Hey, Dr. Balta, how do you adjust the spine?
Nice. All right. Well, let's go over that. So, in our office, we have many ways to adjust the spine. Now, most people are used to the hands-on approach, which is called diversified adjustment. Okay, and that's when we use our hands to realign the spine back to the way it was before your injury, or before your car accident, or before your fall, or before having bad posture and then having those bones move out of place. So the way we do that is basically we're going to use our hands to give you an example. So let's say this bone is out of alignment, and we're going to use our hands and gently push that bone back into place. Okay. And when we do that, you're going to hear a popping noise. And that popping noise is just CO2 gas escaping from the joints. That's all it is. Okay. So a lot of people love that kind of adjustments. They love hearing the popping noise. And that's why you watch on TikTok, and you watch on YouTube, and you watch on Facebook. Like, you hear the big popping noise, and people like are all excited about that. But really, to be honest with you, it has nothing to do with the popping noise. All it has to do is how well we move that bone back into normal position, and to make sure it stays that way. Okay, so the popping noise is irrelevant. Sometimes it doesn't even happen. Okay, so that's called the diversified adjusting style, which is we use our hands for that. Now, another technique that we use here in our clinic, and then some chiropractors only use one technique, we use many, because not everybody could get adjusted the same way. We can't adjust you the same way we adjust a 3-year-old. We can't adjust a 3-year-old the same way we adjust an 80-year-old. So that's why we use different techniques. So I'm going to go over the second technique, which is called the drop table technique. And basically what we do on that is the patient will go face down, and we'll use the drop table to assist us with the movement of the bone, basically. Okay, so we're going to put our hands here, and we're going to use the drop here to create that force. So what happens is we put our hands here, we push down on the table drops, so the patient doesn't feel the force that we're putting in. And but with that force that's being put in, it stops. It stops here, but then the bone keeps moving. So basically, the bone, let's say it's locked up like this, and we adjusted, and we use the drop table. Once we drop it, high velocity is going down, and then the acceleration gets stopped really fast, but the bone keeps moving, and the patient doesn't feel too much of the force because the table is taking a lot of that force. This is a very gentle technique for patients that don't like to have their don't want to hear the popping noise, or they don't want to be twisted, or they don't want to be on the side posture, or they can't be on side posture for any reason, either medically or for somehow they just don't like to be on their side when we do that. And also for patients that don't like to be pushed down, and they don't want to have force being put on their back, then we use the drop table here for the mid back. Same concept. Put our hands here, and then push down, and then move that bone. It sounds louder, but really it's very gentle, and the bone will move into place. Okay? Again, the goal of the adjustment is to move the bone back into the way it was before the accident, before the injury, and before the trauma. All right. Now, we're not done yet, because you think, okay, 2 ways of doing it. Now we have a third way, okay, which is called the impulse adjusting. And this is an instrument adjusting. And basically, with this, we're going to use an instrument to move the bone. It's very gentle, and you're not going to really hear the popping noise as much. So, for the people that like popping noise, this is not for you, okay? But for people that don't like it, this is for you, because you don't hear it, and it's very gentle, but yet it still moves the bone. So, we're going to move this bone right here, let's say. So we get on top of it, and we move it. And as you can see, the bone is moving back into position. Okay. And it's going to move gently, and it's going to move very effectively back into the normal position that it needs to be. And again, this is all based on palpation, x-ray, and exam. So we don't just go in there and start moving bones without knowing where to move them. And that's the important part, is we're not going to go guess on which bones to move. That's why we take x-rays. That's why we palpate. That's why we do an exam. That's why we do a diagnosis. So we know exactly which bones to move, because we can move bones, but we can move them out of place. We don't want that. So we want to make sure. So this is the third option that we have, which is the impulse adjusting instrument. Now, fourth option is the activator adjusting. And again, this is an instrument adjusting. And instead of using our hand, we're going to use the instrument to realign the spine back into normal position. Again, give you an example of that. And we can have different settings. For kids, we put it on the low settings. For adults, we open it up a little bit more. And then we gently put it on the bone and then move the bone back, as you can see right there. Okay. So again, the bone is out of place like this, and we gently put it back into place. Okay. And again, the whole idea of this is to get your spine back to the way it was before your accident, before your injury, and then get your body healing the way it's supposed to be. Okay? Because your body's going to heal. It's going to heal it either way. Whether it's out of alignment or not, your body's going to heal it, but it's going to heal it in the wrong direction. We don't want that to happen. We want to make sure your spine is straight. We want to make sure your alignment is good, and also the nerves are coming out freely without any kind of impingement. And that's what the adjustment is all about, getting you back to normal, kickstarting the healing process in your body, and then getting your body moving the way it's supposed to. Okay? I hope that helps. And you guys, listen, if you want to come and try out any of these instrument adjusting or any of the adjustments, please give us a call. And if you're suffering from neck or back pain, please don't suffer any longer. Give us a call and we'll take care of you. All right? Hope that helps.